and welcome. You're watching Medically Speaking, and I am Meenakshi Upreti. Joining me is Professor Anil Arora, and who needs no introduction. He's a regular here at Medically Speaking, really an expert we go to understand complicated matters. He's the head of the gastro department at the Sir Gangaram Hospital as well. So thank you as always for taking out time for NewsX. First question, monkeypox making headlines. But do we actually need to worry? Because cases are being reported in India and in Delhi as well, sir, as we speak.
Yeah, thank you, Meenakshi, for having me in your show. If you look at the way the virus has been spreading over the world, we have already recorded on 23rd July, that is 4 days from now, about 16,000 cases in almost 75 countries. And this virus has only recently surfaced. If you remember, we did the similar show about 2 weeks back when there were just the beginning of the reporting of the few cases. That only shows that the virus has been spreading, even though we do not need to be panicky about it, but certainly we need to take precautions. We have to be alert about it. And the more we understand the biology and the physiomechanics of its transmission, it will be better for us as human beings and public, as well as for the government agencies, to nip the problem in the bud and to control the problem before it spirals down to the level of COVID.
Sir, how does monkeypox spread? Does it spread only by sexual transmission, or is it even airborne? Because confusion around it.
Yeah, in fact, this is a virus which, unlike COVID virus, has no proof that it spreads by the aerosol route. That means through the airdrop infection, unless you are in the close proximity. Of almost all patients, except for few which have been reported from India and few children in the UK and US, most of the cases have been reported in M2M, that is male to male sexual transmission. So in which there is an intimacy and there is a physical contact of a prolonged time. So that is a basic prerequisite. By default, unlike COVID-19, which was spreading by the aerosol route from human to human, this virus called monkeypox virus, which is an orthopox virus family virus, is more likely to spread from animals to humans. And if it has to spread from the human to human, you need to have a prolonged physical contact. Just by sitting with somebody or having a cough onto the face of the other may not spread the virus. But then in terms of the infectious secretions, because this is associated with the skin rash, which was not present in COVID. And almost all components of the skin rash in the form of blisters, in the form of pustules, or the scabs may contain infective material. And if in country like India, with overcrowding condition, and if you are sharing the same beddings, linen, and the wooden apparatus, then as a fomite also it can spread. So even though aerosol route is not documented, but close proximity, poor condition, and sharing of the multiple objects in which the virus may be remaining viable as well as labile may be able to spread the virus completely.
Right. And also, sir, this is not a new virus, isn't it? It's existed sporadically, at least in Africa. What's the reason now that we are seeing this type of a spread, sir? Can this be explained at all?
Yeah. You see, it was discovered for the first time in the monkeys in a place called Zaire, which is not called today. It is called Congo. Now, in Congo, in the experimental animals, this virus was discovered in the monkeys first, and hence it was labeled as monkeypox virus. It was only in 1970 that this virus started spreading into the human beings. And primarily the disease was restricted to the African countries, Tanzania, Zaire, etc. In 2003, there was an export of these squirrels and pets and the mice and the rats to a showroom in New York, which imported possibly this virus. And then there was the first epidemic in which hundreds of the cases of monkeypox viruses were reported, and this possibly were imported from the Africa to a pet shop in the US. And once it had spread, it got localized because all those animals dead and the vaccine and the infection got controlled. As the travel is increasing, so you have movement of these pets which were carrying these viruses from African countries to the various components of the bird, including human beings which were handling these animals, and then it started spreading from the animals to the human beings. And for the time being, it has been spreading mostly in people who had a close contact. The classical is men-to-men sex. In fact, majority of those who have been reported to have this infection is because of the physical proximity. But mind you, now there is a human-to-human transmission rather than banking on animal-to-human transmission. In the 4 cases which have been reported in India so far, the 4th is suspected. At least 2 patients do not have a history of spread. So we do not know whether the virus has got mutated or there has been an incidental contact during travel.
Yes, exactly. That was my next question, sir, because earlier all of us had sort of taken a backseat far as monkeypox is concerned, because it was very limited to, of course, as you said, the LGBTQ community, and it was believed that it spreads by sexual intimacy. But now, since the origin in a few cases is still in a question mark or in a gray area, what do we know, sir, about the spread? Possibly, could it have mutated? Is that a possible?
Yes, it is a possibility, but as of now, there is no proof. But if you look at the trajectory of the spread of the virus, even WHO director, Dr. Tedros, has declared it as a public health of emergency of international concern, which is a big event. There have been only 7 times that any particular viral disease has been characterized as PHIEC. So that means they are also concerned about it. And the way you have had recorded so many patients, especially after learning the lesson from COVID, which has devastated the economy, the livelihood, and the lives, I think if we take the precautions, go in for surveillance and spread the ways the virus spreads, and the education and the public awareness, that will be a big benefit for all of us.
No doubt. Precaution always better than cure, sir. A question or 2 more before we let you go. One really about all of us at large. Now, since there is a possibility, again, no evidence if it possibly has mutated, how it's spreading, how can a person protect themselves from monkeypox virus? The only logical thing a few days ago was, of course, not to indulge in a sexual activity with someone who had lesions, someone whose sexual history one was unaware of.
Yes. You see, there are 2 ways the virus can spread. A person who is infected, and if you have a close sexual contact, as you very rightly said, it is LGBTQ community which is getting this infection. If you go down on your sexual activity, do not come in contact with a person who has had history of travel abroad. Anybody who is suffering from fever and has a evidence or some symptoms of the rash, this is something which should be reported to the agencies. We have a National Disease Control Program. We have other agencies, health agencies, which will take care of collection of your samples and send it to NIV in Pune for confirmation. So at our own level, we should avoid the physical contact with the person who has a fever. You never know. Patient may still be in the incubation period in the early phase. Rash may follow fever. So it's important that you avoid the physical intimacy, especially the unnatural type of sex, which is the man-to-man sex, that should be avoided. Use a mask. Even if you have to go in for sex, then condom is something which is recommended you, because you will be able to avoid the contamination through the secretions. And at the slightest suspicion, do report to the agencies, because in case you incidentally get infected, unfortunately, you may be able to prevent the spread of the infection to your peers, to your family members, and your near ones and dear ones. So do report to the agencies which can take appropriate measures to isolate you and take care of your own self.
Very, very, some informative points, of course, which you gave out, sir, for our viewers. Of course, we do hope that everyone stays safe. Of now, of course, nothing to worry. But the WHO has sounded the alarm bells, of course, learning our past lessons from COVID. Till now, very small likelihood of the disease being airborne. It seems highly unlikely, but yes, as Dr. Arora says, precaution better than cure. Thank you, sir, for joining us on NewsX and sharing your thoughts on this extremely crucial topic, sir.
Okay. Thank you. Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.